Hi everyone, I'm Vandana Rai from Immigration Advisors New Zealand. This video is for all of you who were thinking of either studying in the healthcare sector or switching jobs to work in the healthcare sector, whether you are offshore thinking of selecting a course in New Zealand, or whether you are in New Zealand working in a different industry but now want to switch over in the healthcare sector. Getting a lot of questions from people who are offshore, overseas, on the selection of the study program for them, who've realized the importance of the healthcare industry, and also a lot of questions from all of you who are onshore here in New Zealand. So with the COVID-19 and the associated issues, most of you have realized the importance of the healthcare professionals. We did see that Immigration New Zealand allowed more than 20 hours of work rights to students who were working in the healthcare industry. Even those who were already working in the healthcare industry, considered to be an essential work, were allowed to vary their work conditions. So everybody has actually realized the importance of the healthcare professionals' work. That was one thing. Apart from that, we do have few people onshore who had a degree in medicine, healthcare, nursing, and they came here and selected a different program to study in and were working in a different area. And recently they've kind of realized that if they go back to their previous line, if they go back and work in the healthcare sector, probably their pathway towards residence would be faster. Why would that be so? I'll just explain. So we do have nurses here who've studied something else and are working somewhere else just because they could not become a registered nurse. So now what happens is, if you look at the Ministry of Health and their pay equity with the healthcare industry, or what commitment have they given through this, the pay equity is that anybody who either has a 12-year work experience in New Zealand in the healthcare sector, or have a level 4 qualification in health and well-being, they have to be offered a remuneration of $25.50 an hour if you're working in the healthcare sector. So all those who were previously qualified working in any other sector, if you plan to do a level 4 health and well-being while you are here in New Zealand, this will lead you to an opportunity to work in the healthcare sector first, and immediate remuneration of $25.50 an hour or more. And we did see a few months back that a personal care assistant, a role or duties which very closely align with the healthcare workers as well. That's a skill level 4 position, but as an exception, it is being considered as a skill position for residence visa as well. So here you go, you got a level 4 health and well-being, which leads you to meeting the salary remuneration, and if you get employed as a personal care assistant, immediate pathway towards the residence as well. And for all of you offshore who were thinking of studying, few years back we saw everybody just coming in for generic courses, generic business courses as well, and most of you have realized that we really need to work on your skills, and you really also need to work on the skills that New Zealand requires, or the country you're studying in would require. So all those students who are offshore and thinking of what to study, I will just give you a few options that you have in the healthcare industry. So if you've recently passed out from your school, you could probably select a healthcare program, level 5, level 6, level 4, and you have 6.5 bands in each module. Probably go for bachelor's in nursing. That will lead to nursing registration. You'll be able to work as a registered nurse here in New Zealand, and an excellent pathway for you. For those who find it difficult to reach 6.5 bands, probably an alternate course, a level 4 in healthcare and well-being, level 5, level 6, and it could lead to nursing as well if that's what you are aiming for. An option for all you overseas qualified registered nurses. So if you've got 7 bands in each module, language proficiency in English, if you have 2 years post-study or a nursing experience, another option for you is to do a competency assessment program, a CAP program here in New Zealand. This will lead to a registration with the Nursing Council, and you'll be able to work as a registered nurse in New Zealand. If you are a registered nurse overseas, however you don't have 2 years of post-study nursing experience, or you are unable to reach 7 bands in each module, another pathway for you would be probably to get cross credits, come and do a bachelor's of nursing with cross credits, get a registration to work as a registered nurse. So another good option that you have for you. And then we do have a few other people who would like to change their career path, who don't have a qualification in nursing. We do have few other options wherein there are some programs at master's level wherein a prerequisite is not a nursing qualification, and those masters in nursing would also lead to a nursing registration, provided you have a 7 bands in each modules in language proficiency. That's really mandatory for you to work in the sector. So all the very best. I'll really be happy to give options for all of you are thinking of working as a healthcare professional, because I do know that the jobs are much in demand. I am aware that the lowest salary that you would start getting once you are qualified in this sector would be enough for you to apply as a skilled migrant resident visa here in New Zealand if you're meeting the points threshold as well. And I've really not seen anyone who's qualified in this sector meeting the requirement and not going ahead towards the pathway to residence as well. So all the very best. Do let me know if this video gave you clarity, or I've answered most of the questions you had. I would really appreciate if you would like the video if it did, if you could subscribe to our channel. So I'll keep adding on to our series just to spread as much awareness as we are able to. And do let us know if there are any other topics that you would like a clarity on. I'll be happy to make further videos on that. Thank you so much.